Figuring out who's in your health insurance network and who's out of network can be tough at times and costly. Well, now there's a move to protect Coloradans from surprise medical bills. Political specialist Sean Boyd live now at the Capitol for us. And Sean, a lot of people are going to be impacted by this.
Karen, no matter how diligent you are, you go for surgery, your hospital is in network, your doctor is in network, and then you get a bill from a surgical tech you didn't even know would be in the room who isn't in network, or you have an emergency and you end up at a place out of network. This could happen to anyone, and lawmakers are determined to stop it.
On September 1st, 2016, I got the text message that no parent wants to get.
When Zoe Williams' daughter broke her leg, she did what any parent would do in an emergency.
We traveled by ambulance to Denver Health. We stayed overnight. My child was put in a half body cast. And it was 6 of the hardest weeks of our life.
She would only learn later that the ambulance and hospital were out of network. Insurance refused to pay.
We are over $15,000 in debt.
More and more Coloradans are getting hit by surprise out-of-network bills.
Lawmakers are cracking down with legislation barring out-of-network providers from billing patients in the first place. Under current law, patients don't have to pay the bills if it's an emergency or if there was no way of knowing the provider was out of network. But most don't know that when the bill arrives.
Some providers have gone so far as to send people to collections and have liens put on people's homes. These bills can happen to anyone.
Just ask Representative Brittany Pedersen.
I ended up receiving, instead of a bill that should have been $2,200, was $26,000.
Zoe Williams says her insurance ultimately paid after a 6-month battle.
Had we not been willing to fight, our entire financial stability would have been destroyed.
Now, I've reported on previous bills like this that have failed, but this year there are 2 bills, both bipartisan, so there is hope. Medical Society does support one of the bills. Hospital Association hasn't taken a position. You should know these bills only apply to state-regulated insurance plans. Most of us are under federally regulated plans, but it can be difficult to differentiate. So the hope is if one of these becomes law, providers will bill insurers and not patients regardless of the plan. We'll see. Live at the Capitol, Sean Boyd covering Colorado First.
All right, Sean, thank you.